of us might be carrying it, and if we don't practice social distancing, we are endangering ourselves. We don't want to spread the virus here or in any of our gatherings. So, without any more waste of time, I'm going to hand over to the Premier. As you know, we have called this briefing after the announcement by the President on Tuesday, so that as the province, we can also explain to you what are the specific things that we will be doing to enforce the nationwide lockdown as part of the attempt to curb the spread of the coronavirus. Over to you, Premier.
Thank you very much, Thabo. Good day, ladies and gentlemen from the media. Today, we are going to announce the specific measures we are taking to reinforce the implementation of the lockdown and additional measures announced by the President on Monday evening, the 23rd of March. From the outset, I want to indicate that we will not deal specifically with matters pertaining to security and policing, because the security cluster of ministers will this afternoon make a media briefing announcing specific measures. We will await the announcement by the security cluster from the National Command Center as it pertains to security measures and such related issues. I also want to indicate from the beginning that we will not deal with the economic measures because the economic measures have been dealt with comprehensively at a national level, and we have done our own economic impact assessment of what COVID-19 means for the Gauteng economy. We have done that, but we had to await the directive from national government because matters of economic policy, macroeconomic policy, fiscal policy belong to the national purview. So those two areas, the economy as well as security, matters of state security, we will not deal with them today. So what will we deal with? We will look at strengthening the measures we had put in place immediately after the declaration of the national disaster. We know that the numbers are increasing rapidly. We are going to deal with that, and Dr. Masuku, who is the head of our committee of MECs in Gauteng, who's coordinating this response, will say something in detail about that. We will also outline a package of interventions to cushion the poor and vulnerable households. This is in addition to what was announced yesterday by the social cluster of ministers. We will identify what in Gauteng specifically we are going to do, something that is within our power and within our budget. We will look also in terms of education, the basic education sphere. Provincial government is responsible for basic education. Look at the measures we have put in place in this regard to assist learners in Gauteng to catch up. Let me frame what we will be saying today by first saying that the President has announced a nationwide lockdown as a response to the rapid rise in the number of people infected with COVID-19. The President also announced additional measures to mitigate the social and economic impact of COVID-19. And this was given further detail by the ministers at a national level. As Gauteng Province, we welcome the decisive decision by the President and the National Command Center, particularly in instituting a lockdown, because as a country and as many parts of the world, we face a threat of existential proportions. And as a province, because of the reasons we will continue to outline, we are now the epicenter in South Africa. We will continue to explain the circumstances and the conditions that make Gauteng Province vulnerable and what we are doing. We are doing as the provincial government, working with municipalities in our province to address this set of factors and circumstances. The Gauteng Provincial government fully supports the lockdown and all the new measures to contain the spread of COVID-19 and to flatten the curve. And we are amongst those provinces already that was feeling that the initial measures are not enough. We are feeling the pinch. We were already feeling the pinch. That's why we welcome the decision for the lockdown. With all the impact it will have, this is the best decision for our country. We stated last week, Wednesday, at the media briefing right here on the 18th, that what makes our province more vulnerable for the outbreak of COVID-19 are a combination of factors such as the following. Firstly, that Gauteng has two ports of entry, the OR Tambo International Airport and Lanseria Airport. And we know, as we will continue to explain, that aviation and air travel has been one of the key factors through which COVID-19 spreads. Secondly, we also, the capital city that hosts more than 130 foreign missions in Tshwane. And we know that we are the third largest size of diplomatic missions, third to New York and Washington, D.C. So this just shows how open and how much the world also is connected to our province. Our province is a densely populated province with high density human settlements, and therefore making it very difficult to have social distancing. We have large numbers of our people living side by side in densely populated human settlements, including informal settlements. We also have a mass public transit system that transports millions of people on a daily basis. So that's why, for us, the lockdown, it's going to make it easy. Last week, we had major difficulties with the public transit system in introducing those measures. So we have identified this vulnerability of our province, not as an excuse, but to continue to ensure that we ourselves take a lead as a sub-national government, as a provincial sphere, in doing more than what ordinarily we should do in curbing and containing the spread of the pandemic, and in particular, also taking extraordinary measures to see how we can cushion the impact of this on the urban poor. We have a huge population of the urban poor in Gauteng. Almost 20% of the population of the province is amongst the people we call the urban poor and people who are food insecure. And that's one of the things we are going to announce today is what are we going to do to cushion them from the impact of COVID-19 and all the measures that are being introduced. We, since the 15th of March, when the President announced the national state of disaster, we have met with various sectors of the population in our province. We have met with mayors of district and metros. We have met with leaders of political parties represented in our legislature. We have met with religious leaders. We have met with organized labor. We have met with business. We've also been working with various sectors of civil society in strengthening coordination and the implementation of our response plan at a provincial level, at a district level, and at a metro level. We have implemented a number of measures that MEC Masuku will go through with regard to health, our health response. We have also implemented a number of measures which we are now rolling out, which MEC Lesotho will talk about in terms of our social security response to cushion vulnerable households and those that are food insecure, as well as enabling our learners and parents to continue to do some productive work in order to enhance education under the circumstances. There are other areas we have done work, including on public transport. We are awaiting some measures that will be introduced, announced this afternoon. We said as a province we will wait for that so that there's proper sequencing between what we do at a provincial level and what we do at a national level. I want to, before handing over to Dr. Masuku, emphasize that as the provincial government, we would like the people of our province, the residents of Gauteng, to remain in Gauteng during these 21 days of the lockdown. We are urging them because we know that if people don't remain in Gauteng during this period, they run the risk of getting infected in different places where they may be going, or those who may not even know that they themselves are already infected may go to different provinces. We know we are an economic hub. They may go to different provinces, to rural areas where the vulnerability is even higher. We're urging Gauteng residents in the next 21 days to remain at home, to remain in the province. One of the important reasons we want to explain is that we don't know what the full implications are until the national security cluster ministers make an announcement. Those who decide they want to go, it may be difficult to come back in the next 27 days. It may be difficult. But there are also very good health reasons. We know during the period of Easter, many who live and work in the cities, in the urban areas, who have family in the rural areas, normally travel. But we want to urge that these are extraordinary times. And that is why we welcome the religious leaders across the board, across different faiths, who normally celebrate the Easter. We welcome the decision they had already made, many of them, that they wouldn't have those Easter services. They have done very, very good for our country. But we want to appeal to each and every resident of our province that in the next 21 days, please stay in the province, stay at home, stay in your neighborhood. If you are not part of the essential services, the there's work that will be done by those who are in essential services. The team in government is finalizing working with the Department of Public Service and Administration, the areas that are going to be in operation. But all government departments in Gauteng are complying with the minimum standards. They will comply with the lockdown, except those who are in essential services. So this afternoon, I want to again make a plea to many of us who would otherwise be traveling, not to travel to different parts of our country, not to travel to anywhere else, but stay at home. I also want to take an opportunity to thank the many NGOs and businesses in the last few days who have been doing something themselves. MEC Lesufi will explain what donations we will accept, but I must say we are not accepting cash. There are many NGOs that have been bringing stuff to help the needy, to help the poor, and MEC Lesufi will explain how we are dealing with that. There are many NGOs, many businesses which have been coming to the fore to say that they want to help, and we want to say to residents of our province, those who can, in one way or the other, if you have something you want to contribute to helping without compromising the security arrangements that may be announced later, hygiene and social distancing. We do welcome whatever support that you may want to provide. And MEC Lesufi will explain if you want to offer something, particularly those things that are basic needs, including food. We are talking here about more than 20% of the population of our province who are food insecure and vulnerable, who depend a lot on government monthly food packages. We will welcome that. We will also welcome assistance from those businesses that want to contribute sanitizers, which we have a system of how they'll be distributed. MEC Lesufi will explain, including bars of soap, food. But all that, MEC Masuku's job is to make sure that all that stuff is itself secure before it is distributed, and that it is distributed properly in accordance with the protocols that have been agreed by the province. So MEC Masuku, just deal with additional health measures under the conditions of the lockdown over the next 21 days.
Thank you, Premier, and good afternoon, everybody. We have followed up most of the announcements that were done by the President. And as of the 19th of March, we had already started our own process as the Health Department to make sure that our facilities are actually available for us to be able to deal with the pandemic going forward. So what we have done, which we did announce last week, is that we have, in actual fact, instituted regulations and measures to scale down our own operations and work in the department. And we also said that we are only going to be dealing with emergencies, and we have cancelled or rescheduled all the elective cases and procedures. Elective meaning that these are cases that are not saving life, but improving quality of life. And we all know that there are surgeries that we can't cancel, like your cesarean sections, we won't be able to cancel them. And your trauma patients, actually surgery that we won't be able to cancel them. But by and large, all the other operations have been actually cancelled throughout the province. And we have also had imposed visiting hours restriction in terms of visitors and also in terms of visiting time. But with the lockdown now, we expect everybody to stay home, not to visit any of our facilities. And this is a plea also that our medical practitioners and our health workers are making to the public, that if you don't have any emergency situation, you should be staying at home and not come to the facility. The second part is that we have cancelled all the annual events that were relating to health. I think last week we were celebrating the TB Day, which we normally celebrate. So we also cancelled all of them, including the ones that we are going to have with the department, jointly with the Department of Recreation, our program on Hanyani, which is a wellness program that we engage in. We also have reduced drastically our outpatient numbers, as we said that we are only going to be dealing with those who really require emergency help. And we also have created areas for triaging for patients that are coming for emergency care outside our facilities. Certainly you have seen some of the facilities in Charlotte Maxeke, the tents that have been erected, and in Nipara and Steve Biko, which are usually the biggest hospitals that receive a lot of patients. So you are getting triaged outside the facility, and those who've got respiratory symptoms, like your flu-like symptoms, will be done separately from the whole group. And this is one of the measures that we've put into place just to protect the number of people that might be affected. And we have increased drastically the numbers of people who will receive their medicine through a centralized chronic medical dispensing distribution system, which also work closely with other pharmacies in the private sector, your Clicks, your Discam, and the likes, where people can be able to collect their medication, their monthly supply of their medication, chronic medication, and we have increased it up to 6 months. And because we are in a phase of containment, and this lockdown is one of the ways that helps us to contain the rate of transmission of the virus, we have also increased our capacity to make tracing of particularly those who are contacts of those who have been exposed actually to the virus. At the current moment, we have already trained over 1,300 community health care workers. Like we said last week, they are an important component of the tracing teams because of their previous experience and what they've been doing for the past 10 years in relation to TB and HIV. And we are continuing to increase the number of tracers because that's the only way that we can be able to do effectively the containment phase. And we are also have trained them to use technology. Our Mpilo app has become more user-friendly, and we can be able to use it to do a self-screening test and also to be able to be identified that you actually require people to come and visit you and do a swab if you are a high-risk patient. That is it. So our Mpilo app is an important aspect to the tracing process. Currently, because Johannesburg is one of the regions that have got the highest number of contacts, we've already deployed over 134 contact tracing teams in Johannesburg, and hopefully we will be able to have made contact to all those who we know who are contacts, because we have to differentiate that part, because if we have not been identified as a contact, we won't be able to visit you and trace you. But all those who are known, we are hoping that by the end of the day today, we would have covered all of them. We have a big problem with those who test in private labs or through private doctors, that their forms, their lab forms usually don't capture their details exactly where they are and where we can find them. But the process has been smooth. We have not had a lot of resistance, except one patient who actually refused us to come to see him. But we have followed up with the legal team, and we'll see how it will pan out. And as we said last week, we are continuing to increase our capacity in terms of the personal protective equipment. Already the first stock has been actually delivered. We are continuing to increase it. our aim is to get to a point where we are almost a week ahead in terms of our PPE, because we also know that it's an important aspect to protect our healthcare workers in when they are dealing with it. But again, it's important that we use science, we remain rational and logical in the usage of PPE. So we don't have to use it at random and without any actually reason. So we follow the guidelines that are identified, that are recognizable by the World Health Organization, as it were, because all of us would have actually worn masks today, but I'm certain that we don't do that because we understand when you have to wear a mask and gloves. The issue of the bed capacity, we've indicated that we're working on the number of the beds that we have inside our public service and also outside. But on this point, we have to be clear on the type of people that will require institutionalization. So those who are negative, who are suspected to be having exposed, will naturally require to be quarantined until we get their results. And you know that the majority of our patients currently have been self-quarantining successfully. But now we are getting to a phase where we're going to get contacts who won't be able to self-quarantine, and we are making arrangements for such. And isolation, it's also when you are positive, but you've got mild symptoms, and you don't require any medical attention at that point, but you can self-isolate. We're also making arrangements actually for that period of time. We have already made enough, over 1,000 beds that will be ready. Already we are having a group of students who are under actually quarantine in one of our facilities that we've identified across the province. The private sector has come into party. They've also offered us when we are going to require beds, over 200 of them at the moment, and will escalate as we need them. And we are happy to also say that we've been quite fortunate, maybe, that we have not had a lot of patients who have required hospitalization. Currently, we are talking about a number of around 5 of them, and all of them are doing well. 2 of them have been out of ICU now, and they are actually ready to even go home. And this is what we are, actually looking at currently. So all these measures, ultimately, is that we have to stay home. We have to make sure that we make use of this phase of the lockdown to improve our rate of contact tracing and also to reduce the rate of transmission. And we are quite confident that we'll be able to do it, but we won't be able to do it alone as government or as the health department. We require your cooperation in many respects. And I think just to reiterate what the Premier have said, it's important that people shouldn't travel outside the province, because if you do that, you are putting other people at risk where the transmission rate is quite low, and it's just logical. And when the Premier says you might not be allowed to come back, so I think we must just also, as we have always maintained, let's remain rational in all the times and logical when we are dealing with this actual response. MSc.
Thank you, Dr. Asuku. MEC Lesufi will deal with the social security measures, and then I will come back and ask 2 more MECs to say something. The MEC for Sports, Arts and Culture will say something, and the MEC for Infrastructure, how we have been supporting both the Department of Health on additional infrastructure requirements. Now we are going to be supporting the Social Development Department on the vulnerable groups that MEC Lesufi is going to talk about. MEC Lesufi.
Thank you so much, Honorable Premier. Truly appreciate the opportunity. Ladies and gentlemen, we have prioritized 4 groups of beneficiaries. The first group that we've put majority of the resources on are what we call homeless people. These are people that are either sleeping on the streets or under the bridges and other things. So we've identified them as a group that needs to be sheltered firstly for a period of a month. That covers the entire 21 days, but also that need to be fed because they rely on begging with the number of people that are no longer available on the roads to beg from, so they might be on their own. But thirdly, which is very, very important, is to strengthen the NGOs that service them because we've got those NGOs that service this kind of constituency. So in terms of support, we are now relocating, and I will underline the word willing, unless the security cluster, as the Premier indicated, the security cluster later on advised otherwise. We are now relocating all willing homeless people into our schools. There are schools that have what we call boarding facilities, because schools are closed now. There are schools that have boarding facilities. We are now persuading, and we've managed to persuade majority of our schools that have agreed. We are now persuading all homeless people. There is a team that has gone out to negotiate or speak to them, that it will be in their interest to be accommodated within our schools. So I will go through corridor by corridor that we've identified, because fortunately, majority of them are at the inner cities. So in the central corridor, that is the Johannesburg corridor, we've identified Roodepoort, Midrand, Sandton, Randburg CBD, Hyde Park, Rosebank, Auckland Park, Boysens, and Brixton. These are the areas where we have majority of homeless people. So I'll take you through the schools that we've identified that will provide all this kind of support. But I'm underlining the word willing because this kind of sector resists to be formalized. So our teams are working very hard to ensure that they are persuaded to accept. The Eastern Corridor, that is your Ekurhuleni Corridor, we have identified the following inner city areas, that is the Boksburg CBD, Captain Park CBD, Benoni, Germiston, Alberton, Brakpan, and Springs. These are the areas that we have identified to take care of the homeless and to ensure that they've got accommodation, they've got clothing, and also they've got food that we can provide daily. In the Northern Corridor, that is your Tshwane area, we've identified the following areas. That's the Tshwane CBD itself, where majority of them are based. Centurion, Silverton, Sunnyside, Main Lane, Linwood, Cullinan, and Bronkhorstspruit. These are the areas that we've identified for the Northern Corridor. For the Western Corridor, we've identified the CBD of Randfontein or Krugersdorp. Those are the two areas only that we've identified. So there is a long list of the names of the schools where we'll place them. So I don't want to bore you. That information will give it to the team so that the team can be in a position to deal with that aspect. Within that context, therefore, you've got people that are in the informal settlements or people that are trapped in areas where there will not be any economic activity for the 21 lockdown days. So we have now released 235 food distribution centers. These 235 food distribution centers are people that are already distributing food for those that don't have access to food security. So we are amplifying them in terms of their capacity. So what they're doing now, instead of providing people for a week supply, they're now giving them a month supply. And these areas are majority covering your informal settlements, your semi-rural areas in Gauteng, or where we've identified areas where children are staying alone. Then the second group that we are prioritizing are children. And these are children at risk, and we've categorized them in three categories. The first category is school-going children. You know, the school-going children that got school nutrition. that normally get their school nutrition. And because the schools are closed now, it's difficult to get the school nutrition. So we are converting the school nutrition into a grocery supply. So where children get this kind of food, we'll be in a position then to go and collect food in those areas. We are using the same distribution centers that we're using for the homeless to also provide, because there are other children that are using scholar transport to go to school in the other area, so they can't use the scholar transport. Hence, the database that education has provided for social development will use that database to reach those children. That's the first part of the grocery for a month as well. The second part is what we call dignity packs. These are children that, especially the girl child, that receive dignity packs from government. The dignity pack consists of your face cloth, toothbrush, toothpaste, to roll on, and all those things. For the very, very first time, in that dignity pack, we are now adding the sanitizers, the mask, and the gloves, so that those particular children are protected as well. That's why we say that children at risk. So we're providing those sanitizers, the mask, as well as the gloves, so that we can. Then the third category is those that are sick but at home. There are many people that are staying alone at home that are sick. So we're using community development workers. We've identified almost 3,800 that are in Gauteng, community development workers that normally visit these people. So it's not something new, we know them. They normally visit them. This time, they are carrying the support machinery that we're giving them, the groceries, and if there is a need for any other thing outside what we're providing, they will give us those particular reports. The last group, it's twofold. Let me start with the first one. There are people that normally come for our soup kitchens. You don't know where they stay, but when it's time for soup kitchen, they emerge. So those soup kitchens are going to be strengthened. But the strict advice that we've received is that this time, instead of sitting there and eating, they will only be given takeaways to manage the numbers of people that need to be there. So the soup kitchens will be strengthened. We are looking at the demand because they used to get their food between 9 and 11, but we want to introduce the afternoon leg, but based on demand, the afternoon leg will also be introduced, that we have. And the last part is shelters for abused women. We've got 24 shelters for abused women that we also want to accelerate. In my home language, they say, with people that are going to stay together for 21 days, possibilities of abuse and fights are high because so we're opening 24 women's shelters in case a woman feels that this man has changed. It's not the what I fell in love with since these 21 days. I want to leave. So we've got 24 shelters that we've identified in Gauteng. And there, when they are there, they will be given all the relevant support in terms of the dignity packs, in terms of the food that we're providing. The Premier indicated that we needed to provide, maybe before I go to the NGO, so any other person that we have identified and society feels we have not reached that person, we have created a call center number. So members of society can call us to say, I know this granny, or I know this woman, or I know this child. You have not reached this child for one reason or another. So the number is 0800 428 8364. That's 0800 428 8364. That's the number that members of society can alert us to say, we know this person is going through difficulties of poverty. Please come and assist, so that our social workers can go and verify that information. Those that are using emails, you can email to support, that is SUPPORT, support@gauteng.gov.za. And that's the part that we'll provide. I want to go to the NGOs. We've been inundated with NGOs that want to provide all forms of support. We've now created a central warehouse in Gauteng. So we are saying to NGOs, or organizations or business or churches. We don't want to add a burden to you. You call us, the numbers that I've just provided, you call us, and on the basis of your call, we'll then send people to come and collect. So don't say, I don't have transport to bring it. We'll provide transport as the Gauteng government to collect and take to the central point, and our health officials will then vet the food and everything that is in good condition and then release it to be part of the processes that we've just identified. Honorable Premier, I want to leave it there. I can come later on education-related matters. But this is the kind of support that we're providing as a Gauteng Provincial. With education, there are 3 areas that we want to provide as quickly as possible. The first one is that with the holidays the way they are, we really believe that they've disrupted the academic program completely. So we've now initiated a labor-led negotiations with labor unions and stakeholders within the education sector to scrap the June holidays in Gauteng, so that when we come back, we want to run until the end, so that there are no breaks, because they've already had a break as part of the catch-up. Because some of the programs that we have are dependable on access to data or technology, and majority of our people don't have access to those things. So we've now officially introduced negotiations, or negotiating with those, so that we can let go the June holidays and use those holidays to catch up. There are 3 catch-up programs. We've got what we call a school improvement program, which is going to take Saturdays and afternoons, and then we've got camps that are going to take place during the September holidays, and also to assist learners to go through their exams. And then the last one we call the walk-ins, those that feel that I need to walk in at a school, and I be provided with the relevant support. We finalized, and thanks to the National Ministry as well as MultiChoice, we finalized an agreement with MultiChoice. There are 2 channels that are starting on the 1st of April. Those channels will teach our learners like they are at school. We've identified priority subjects, but all the subjects will be covered. That channel is going to be based on MultiChoice. DSTV are going to use mindset information. And then we have signed an agreement with 2 service providers, free of charge, and we must thank them. The first one is Telkom. Telkom is 0 rated. So what we've done, we've taken our curriculum, deposited on a Telkom platform. Whoever used Telkom can then utilize the platform without paying and get access to materials. The third institution is Vodacom. We've also signed an agreement with Vodacom, and Vodacom is providing their curriculum free of charge as well, so that people can go through that during the lessons. We'll continue with our online support with Nalibali, which is an institution that is providing reading and writing skills for quite some time, and Seavula Books, which is maths and science books that have been made available to everyone. So whoever wants this information will be made available on our website. The last part is radio broadcast, because majority of our people might not have an access to a DSTV or have an access to online. So we are utilizing radio for the following grade 12 subjects: life science, physical science, maths lit, economics, business studies, tourism, English, English as an additional language, accounting, history, and geography. We've finalized arrangement with the following institutions: SABC is Ukhozi FM and Lesedi FM. Regional stations in Gauteng is YFM, Kaya FM, and Power FM. Community stations is Jozi FM, UFM, Kasi FM, Theta FM, LX FM, Cosmos FM, UT FM, Moretile FM, Caps FM, Enkangala FM, EK FM, Voice of Tembisa FM, MAMS FM, and Peli FM. So that these community radio stations can also provide additional support on this particular subject. There are also regional radio stations starting from the 1st of April to the 16th of April. This is Kaya FM, YFM, Power FM, UFM. These stations will carry academic programs, and we urge parents to tune in and follow the lesson that are provided there. Thank you so much, Honorable.
Thank you, MEC Lesufi. I want to come to the MEC for infrastructure development in terms of how we get part of that readiness of the infrastructure required by both our health department, education, and social development. MEC Mutara.
Thank you very much, Premier, and good afternoon to the colleagues. Just from an internal point of view, we have identified all the staff and officials that are based at our health facilities to make sure that the health facilities are fully maintained and operational. So they are at the hospitals as well as linked to the clinics that the Department of Health has identified to be fully operational during this time, and they have been deemed essential services staff from the department. With then we are assisting the Department of Health with the provision of additional beds. Two facilities where we are doing renovations are in Lenasia South and Discoverers. That's underway to provide additional beds for the Department of Health. We are also entering into agreements with private entities who have made space available in their buildings. One is in Carltonville and will prepare an additional resource of beds there. And then together with the Department of Health, we will finalize the support structures for additional beds in that will support the city of Johannesburg, the city of Ekurhuleni, and the city of Tshwane in particular. We've also scaled up our equipment, in particular at the Masekane Cook freeze, and that is to deal with the additional bed demands. And because you have additional bed demands, you'll have an additional demand for increased food. So we have we've finalized that process just to be able to address the additional demands that will come from making additional space available at the different hospitals. Then together with the Departments of Education and Social Development, MEC Lesufi speaks about the schools as well as the facilities that we want to use for vulnerable and particular homeless individuals. We don't necessarily foresee that we'll have to do additional work at those boarding schools, but if the need be on an emergency basis, we will be able to provide that. We finalized it yesterday with the Department of Education as well as Social Development just to be able to repurpose the space, but also make sure that the school can be used for, so if there is any sort of emergency work, however, the schools that we envisage will use are the schools that are currently in use anyway. So by Friday, we would have been well on our way to meet the target of 2,000 additional beds that the Department of Health needs for the different categories of either quarantining or isolation, depending on what the need will be, and the MEC of Health has indicated what the different categories are, whether isolation, but also just quarantining where people will not be able to self-quarantine because of their own living conditions, space-wise, etc. So we are targeting 2,000 beds. The bed internal and external capacity currently that we have is just over 600. Thanks.
Okay, MEC Masuku can explain the issue of the beds, what they are meant for, the 2,000 beds. And MEC Maile will say something about the water situation, because in our Provincial Command Council meeting yesterday, we have assigned him a responsibility to engage with our various municipalities. He knows exactly which ones need what kind of help. He will be able to deal with that question if it needs be. But MEC Mbali Hlope has been working with the artists, the creative people in our province to also carry the message. And they've been doing fantastic work. I would like her to say something in that regard on how the the creative industry and the sports personalities have been helping us to carry out this message around COVID-19 and what we need to do, all the measures that have been introduced about washing your hands and avoiding touching your eyes, your nose, your mouth. All those measures, how the creative industry in our province has been working with her to get this message out there. MEC Mbali-Hlophe.
Thanks, Premier. I was just to indicate that the department is obviously one of the ones that are affected, particularly because the sectors that we work in, which is sports and arts, rely on mass gatherings and events. And so the virus and the measures that are put in place is an antithesis to the way that we work. But in our engagement with the artists and the sports personalities was an appreciation on their side that we obviously need to undergo these measures. There needs to be a lockdown, but that doesn't negate that work can still take place. And they have been able to come through and say they will utilize their own influence within society to heighten the voice of government, because they understand that how critical it is for us to ensure that everybody follows the prescriptions that are there and the cautions that have been made so that we're able to get back to life as normal. So in this regard, they've been able, and they've already started the work of utilizing their various platforms to educate everybody, because we want everyone to know what are the things that they ought to do. But importantly, they've also come on board to ensure that we get everything to normality. I was indicating earlier that some of the things that the sector are hardest hit, and we are waiting for the minister to indicate that what are the recovery measures that will be put in place. We obviously can't speak to it as yet, but we are waiting the minister to pronounce in that regard. But our artists are fully on board, and with the 21 days that is coming up, our comedians have come up and they've all put up their hands to say they will be circulating fun things, comics, jokes, but that will be very educational so that people are mindful of what needs to be done. But they also want to remind everybody that we can overcome, because there's obviously a mood that is somber and everybody's feeling depressed because they have to be indoors, but they have an appreciation that what they do within arts, within sports, is very critical in lifting the mood of the country, and it's what is called the happiness index of the province and the country alike. And so they are coming on board with that work. We will be rolling these measures out, and we will be utilizing the various platforms that are there within media, from TV, from radio, and importantly, social media, to be able to release the work that they are doing. And as I indicated, it will roll out throughout the 21 days. With our libraries, because there's also a concern, I've indicated that we have had to cancel a lot of the national days that we are doing, because obviously these are mass gatherings in nature. We can't have those, but we are still able to speak about the importance of the days, utilizing media. And that is what we're doing, but also because our libraries are also affected, and then that they have also been closed, we have now moved electronically, so people are not going to be deprived from still being able to access books. They can be able to do that virtually, from as simple as the palm of their hands through the phone, and you can be able to access all the books that we have. So there are those electronic measures that are in place. Thank you.
Thank you, MEC Mbali. MEC Maile, the municipalities.
Yeah, no, thank you very much, Premier. Maybe it's important to firstly explain that the Minister of COCTA, Dr. Nkosazana Dlamini Zuma, convened a meeting of MECs last week, Friday. And in that meeting, we deliberated and identified the fact that there will be, and that was before the president announced the shutdown. I mean, the lockdown. Yeah. So we had agreed on measures that must be taken by municipalities, because they must still provide essential services. So I think between today and tomorrow, the minister will make that announcement. Then we will, as a province, have a teleconference, because one of the things we are avoiding now is this contact. So we will have a teleconference or a video conference with all the mayors tomorrow, just to go through those measures. So that's the first thing. But the second thing is that we've already been inundated by a lot of requests from the municipalities on what must happen, because They are supposed to pass the budgets and the plans, and that requires council meetings. And if they don't do that, it will have an implication on the essential services. So we've been in contact with the municipalities, and at this point, we are agreeing with them that essential services must not be affected, because there will be those services that municipalities are providing which are not a provincial competence, or there might be a national and local competence, and we will have to coordinate that. And amongst those services will include health and social development that are going to be operational in all the disaster management, fire and rescue services, emergency services, metropolis services, energy, water and sanitation. And on water, we've already identified, working with municipalities and national government, what we call the hotspots in every municipality. And we're consolidating that information. These are hotspots because they've got problems in terms of water provision and the quality of water. And in that regard, the funds will be made available by municipalities to ensure that there is uninterrupted provision of water. Refuse removals and ICT will also remain an essential services. Customer contact centers in the municipalities will not close. And these are some of the issues that have come out from the preliminary consultation with the municipalities. We will then tomorrow consolidate and speak to all the mayors, including on the allocation of resources, because we want to be satisfied that every municipality budgets sufficiently, and we can be able to provide these essential services in the next 21 days. Thank you.
Missy, I said that the security cluster is having a briefing later this afternoon, so the MEC for community safety cannot speak today until there are announcements. We want to be careful about what to say on that. The MEC for transport cannot say anything again, because the public transport system announcements will be linked to the security measures around mobility in this period. I just want to conclude by saying the following so that we can allow for questions. That we have two research institutions that have provided support to these interventions we are making. Firstly, to know targeted interventions. So the Gauteng City Region Observatory, which is our partner, research partner, working with various universities in Gauteng. Many of you know it. The GCRO does research every 2 years, the assessments of performance of government, all provincial government, municipalities. So they have published a report that shows the areas of vulnerability in Gauteng. In other words, if you take into account all factors, where communities, where there may be inadequate access to health services, inadequate access to water and sanitation, greater levels of vulnerability with regard to HIV and AIDS prevalence and TB, which are those areas, food security, access to housing, and densities. This question about social distancing, they have done that work for us and mapped it. We know as we are sitting here, and that is why the decisions on the lockdown are very, very important, that if there are no drastic measures taken, there will be some of our communities and our areas that if the outbreak was to hit them, the capacity to cope will be very, very limited. And those that research is very important. It's informing our interventions, food security interventions, all interventions around support infrastructure, water and sanitation. We know which areas in Gauteng are the most vulnerable areas. The second piece of research was done by the CSIR, and this research also talks to the same set of variables around vulnerable communities and which communities will be very, very difficult to cope with, and social and economic measures to assist those communities should be directed at that. So what does this mean? What does this research mean? Is that as we deal with the health measures that are put in place to trace those who may have made contacts or those who may be suspected to or they may have traveled. As we do that, and the MEC for Health says there's a triangle about where those are, we don't want to forget the communities that will be most vulnerable. We don't want to do that. And we don't want to focus just on where the infections are now with regard to those who have traveled or those who travel often and those who may have made contacts often. We don't want to focus on just the present trends around the virus. We must also worry about if this was to get to its worst case, who would be most affected? So we are combining these interventions now, and that's why the townships and the informal communities and the homeless people and the children and the aged in old age homes are also our principal area of focus. Through our social development budget, that budget is there. The database of the people, the beneficiaries is there already. So we are just increasing our capacity to reach people in that way. So we are informed by science in what we are doing. If you see us escalating activities in particular areas, we are informed by science around how do we ensure that these communities that would be most vulnerable are supported in a targeted way and in a way that will make the most positive impact. The last point I want to make is that over the last few days since Sunday, our Command Council of the province and the Gauteng Executive Council, that's our cabinet, operates remotely. Also, we use digital platforms to set up our meetings, and we have been doing that from Sunday evening, and even on Monday, as soon as the president finished making the announcement, we were together communicating what interventions we need. We're getting reports from various MECs, and this we are going to do on a daily basis in the evenings to be able to communicate, get feedback, and make decisions instantly. We want to encourage the people of our province also that we have many public services available online. Some of this we know it's not known enough, and we want to send out this message there, and we want to go 100% online to provide these services in the 21 days. Of course, it's a function of connectivity. That's why we want to connect again the communities that are vulnerable, for informal settlements, townships. So that's why our broadband network, even as we face in this crisis, to roll out our broadband network to connect to as many areas of the province. Digital connectivity will be important to continue to ensure government operations succeed. So Thabo, we can come back to you for questions, but not on security issues, please.
All right, we start. You just identify yourself and then move to the mic, then identify yourself and ask your question. Let's start with Ndaitse.
It's Ndayezo from Power News. To the MEC of Health, you mentioned 5 patients. Does that mean that from the 366 odd, we only have 5 patients that are in hospital? That's the first thing I want to understand. And the other one is the 2 that you say are in ICU and are ready to go home. Are those part of the 2 that the Minister of Health mentioned earlier this morning, that there are only 2 that are in ICU? Could you please just clarify that for me?
So they can't be in ICU and be ready to go home.
Yeah, no.
But it's fine, we got it. Yeah.
My name is Malungelo Boy from Newsroom Africa. Premier, one of the things that you said, we're living in extraordinary times. We agree with that. And that you pleading with people in this province not to travel to the rural provinces. I mean, people are not heeding that call. People are going home because they're frightened of the current situation. I want to ask then, would you then not suggest to national government that perhaps in this province, because we're the epicenter, should we not close our borders? That's the question. To you, Dr. Masuku, I mean, you spoke about, you said one of the problems that we have is that there's some people that have results that come from private labs and that you don't get a lot of detail in terms of their contacts and contact tracers. I'm wondering then, is that not a problem in terms of us trying to deal with the spread of this pandemic in this province? I also need clarity, maybe you or MEC Motara can help me with this. Do we have 600 beds in terms of the capacity in the public sector, and we're pushing to have 2,000 by Friday? I just need to get clarity on that. Thank you.
See another hand? Yeah, please. Go closer to the mic there.
Hi, Bonga Dulane from EWN. Partially covered my Lungelo Premier on the epicenter being Gauteng, 366 cases. Seems like it's growing at a more rapid rate for Gauteng. You say it's an economic hub. I just want to understand in terms of, in the future, if it does grow more, will you suggest a lockdown, as Lungelo had given that? For you, Mr. Masuku, and also possibly MEC Motara, I heard you mention 2,000 beds, and then I heard you earlier on mention 1,000 beds. So can you just clarify for me there where we are on that situation? If I'm hearing my own things, please ignore that completely. And then also you, MEC Masuku, you said something about students who might be possibly have to be quarantined. What's their backstory? I think you just mentioned it, and then you left it. They have been tested. Are they tested? Where are they coming from? I'm just trying to understand that situation there. And then also for you again, in terms of this health situation growing, are we talking here maybe asking retired health professionals to come through? Because 21 is a long days, and we've seen this virus is growing. So are we looking at that as asking those who have retired and also to come and help? And my last question, thank you very much, MEC Lisufi, you said something about scrapping the June holidays possibly. I'm basing that assumption on you hoping that the 21 days would flatten the curve and we'll have to lift the lockdown. What if it doesn't? What's the plan there? Or are we not working on those hypotheticals? Thank you.
All right. Okay.
Sbatle from Jacaranda FM. It's for you, MEC Masuku. So basically, how is the department dealing with the overburden of the facility? So I'm assuming that people are coming, wanting to be tested, even though they may have like flu-ish symptoms. And my second question, just also the department's plan on the lockdown, the 21 days moving ahead. And can we also expect maybe like a change in patterns when it comes to testing? I know right now you contact tracing. What is the plan after that? Can we expect a change in that? Thank you.
All right. Before you answer Premier and MECs, there's just one more question here. Okay. There's just one more question directed to One Health. What will happen to the patients that have ITP I'm sure the MEC knows what ITP is. And their appointments fall within the lockdown, what will happen to them. The other question, it's about the people from, it says, Premier, our brothers from other countries who couldn't get their flights back to their country, who forfeit their bills and their expenses within these 21 days, what will happen to them? And the next question is about the elderly who receive their pension grants. If their dates for collection are within the 21 days, how will they get their pension grants? And the other question was for MEC Mazibuko. We will not entertain that one since we are waiting for the security cluster. Well, it simply says what will happen about enforcement within this period. Okay, we can answer.
Thank you very much for those questions. The MECs will deal with each of the specific questions. I want to say that there is a lockdown. There's a nationwide lockdown announced by the president that takes effect from Thursday night. I am aware, and I have been made aware, that there are significant number of people who are leaving the province before the lockdown takes effect. And these are the people I am talking to, Malungelo, that we shouldn't do that. Essentially, it started yesterday. You saw in Limpopo, the provincial government there has introduced something about actually screening people who are coming into Limpopo. I don't know what the different provinces will do. I am talking to the people of Gauteng. There is a lockdown that starts tomorrow evening. But what people are doing by leaving earlier, I think what we should understand ourselves is the impact of this on ourselves. So someone may think, you know what, under the circumstances, it is better that I am in my home province, in my home village, in my hometown. But the real risk that this poses. So there are 15.2 million people in Gauteng. I know normally during a festive period, we have much fewer people. There's 44% of the people who are in Gauteng at normal time are not people who are born in Gauteng. They are coming from the different parts of our country. So in a sense, we are talking to this large number of close to 45% of the population of the province. We are saying to them, it helps the country. The lockdown is something to help the country. It's to help our nation contain the pandemic. But if people start to move in all manner of places, let me explain something to you. I was born in a village in Limpopo. So you may think that it is better that you are in those provinces and closer to your village. But I also want to advise that those provinces don't have the infrastructure, even with the problems we have of vulnerability. We have better infrastructure here. If in case in the next 21 days you fall sick, I don't even want to talk about testing positive, but you fall sick, there's adequate infrastructure here. I am saying, even under the most difficult circumstances we have here, fear is irrational. And the doctor here says we must be rational. Fear and packing your things and packing your bags and putting your children in the car and getting on the highway and thinking that it is better closer to where you were born, that's irrational response. Being here, closer to where keeping here, it's what we will cancel, but it will help the whole country. it will help the whole country, Malungelo, that we contain the possibility, the square mileage around which we are dealing with, contain this. I imagine the same thing with the Western Cape. You have a lot of people who are in the Western Cape who may be coming from Northern Cape or Eastern Cape. I think the irrational thing around the lockdown is not just about country borders. It is also about where those areas where currently they are hardest hit, their inflection points, such as Gauteng. For a long while, I've been saying we are vulnerable, and now I can see that we are actually the epicenter. We have gone beyond vulnerable. So even those who are here in our province who have not yet tested positive, we say to them, and those who are negative, stay at home. It is safer. You're no longer compelled to go to work now. And those who are compelled to go to work because they are in essential services, there'll be protection, clothing and equipment for them. And the rest in society who don't have to be anywhere else. It helps us contain. That's what the other countries have done. It helps us contain. It's a rational response. It's not an irrational response. It's a rational response to stay in the province. And I am saying, in case anyone in the period of the lockdown needs to have access to healthcare services, we know we've got better infrastructure. I'm saying, even for those who are in the informal settlements, but they are in this 18,000 square kilometer called Gauteng. If someone falls ill, they are in Diepsloot or they are anywhere else, we will be able to ensure that they get the best available treatment here. And we are working with the private sector people to say that it is about saving life now. It's not just the 2,000 or so beds that we are talking about. Any available public health and private health capacity that is here in Gauteng will help us to have a comprehensive response. So I am appealing, using, again, that packing your bags and getting into your car and driving away to KwaZulu-Natal or Limpopo or the Eastern Cape or Mpumalanga is not the most rational response. The lockdown will be undermined by people who want, before it takes effect, to be out of here. But I also say the nationwide lockdown means that wherever you go, you can't come back. Because we are worried about the people of Gauteng who go somewhere else, who may be infected, who may be infecting others. But we are also worried about those who will be coming back, who may be coming to infect others. So the notion of a lockdown, Malungelo, is there. The lockdown, I don't need another Gauteng-based lockdown. There is a national lockdown. It's called nationwide lockdown. You can't do another Gauteng lockdown. But if you go away, you might make me think of it.
Thank you, Premier. I think the questions that were raised by Ndiazo, like, yes, we have 5 patients in hospital, and the 2 patients that are in ICU, yes, that's what we are talking about. And those patients are in ICU, 2 of them are in private facilities, private clinics or private hospital ICU. And the one that we reported last week, in actual fact, he has done so well. I went to see him and the clinician team on Monday. Actually, he's out of ICU. He's now in a normal ward. By the end of this week, we would be actually making sure that he actually goes home. So they are doing well. So there is an element of people getting better. And I think one thing that we need to also mention is that the majority of the people who are COVID-19 positive, they've got mild symptoms which don't require them to be hospitalized. So the worry that we have, by and large, is the worry where you won't be able to get people to self-isolate or self-quarantine. And that's what we are trying to prepare in terms of bed space. The spaces that we have that we actually spoke about in the public sector is when we are going to require them to be admitted. At the current rate and at the current moment, the situation is such that what we have is still enough, you know, and we will be able to. So what we are building up in terms of those ones that we have to remove from the community to actually to isolate them for ourselves. Sometimes it will be also forced by law isolation, because we also have to use the law. Other people still think that they have a liberty under these circumstances to decide on many things, you know, or on whether I'm going to do this. But it is upon the clinicians and the department's assessment if you'll be able to self-isolate or self-quarantine. But if you can't, we will actually use the law to actually to put you into that space where you won't be a danger to the community. I think most of the time it is a problem. The private laboratories is a problem. And as a previous practitioner, a retired practitioner now, the filling forms have been a big problem, you know. So we normally get the name and the age, and we don't know where the person stays. So we are utilizing telecoms companies have come into the space to help us. We've also enlisted consulting agencies which will help us to trace them. So we have been able to trace them. We have built up a big database now, but it's a big problem. And it continuously worries me that there are people who even announce that they're going to do private testing and they're going to be cheaper, because it also makes us misalign our response. And somehow I also expressed this to the minister to say that we need to, in a sense, get some order within the private labs and the people who do some testing. But to add that, we are going to, in the areas that we are looking at, because we are targeting the areas which we are going to introduce extra centers for testing, clinics that will be just dedicated for screening and testing. And we're still going to remain with the case definition, what we call case definition. We're not just going to test anyone. You know, like I said, I made an example last week about a man who will have morning sickness and want to test for pregnancy. You know, so we just want to also have a case definition. Have you been exposed? Have you traveled? And do you have symptoms? And then we need to do the test. So because we won't have the South Korean type of approach where we're going to test everybody and retest everybody. So we just need to make sure that we do that. The students that we're talking about, they came back from China. They were FET students coming back from China. They are not anyway. They are, in essence, what we are calling quarantine. Remember, we made the definition. So they are negative. We are just observing them over a period of time to make sure that they are fine. And at this particular point, they've been doing quite well, including the group that we repatriated that is in at the range. You know, they are doing quite well, and certainly they would be closer to the point where they will be going home actually soon. And the issue of, we are going to, I think one thing, we'll just request all those who want to volunteer. I think we've received a lot of them in our social media platforms and everything. All going to request them to at least visit or go to their district offices in different actual districts to avail that. Their services. Actually, we have made the call, and even employing where there is possibility of employing more hands actually for this nature. The issue, okay, I've covered the issue of definitions, case definition, and that we you know, depending on the situation, we might change the criterion case definition. At the moment, we know that the resources are quite tight, and we might not be able to test everybody. With extra testing facilities, it will make it easier, particularly for those when they're doing more contact tracing and we'll use more methods to make sure that we're able to get people that we require to test, not everyone. You know, other people with mild symptoms, maybe with, will still have to be self-isolating for a particular period, because we also keep insisting that we'll maintain our point. On this one, I think we should be continuously saying, Premier, that people must remain logical all the time and rational, because sometimes that's where the problem is, where people just come up and say, I want to be tested. The last point on the ITP. ITP is idiopathic thrombocytopenia. Usually these are patients that have got a suppressed immune system. And I think it applies to all of them. You know, I think Steve Biko, Para, Charlotte, they run most of these clinics, which are specialized clinics. Clinicians here, they make a call. I've made it a point that clinicians must undertake to make determination on many things, so that we don't, as politicians, take decisions without them being the one that inform those decisions. So, and those clinics, they've got a very close relation with their patients. Certainly they've made arrangements and they've been able to contact them and see how they can be able to get their treatment and get assessed. Because also these are not just ordinary patients. These are patients that require extra problem. And I guess it also, endocrine clinics, your oncology clinics, all of them, they do have that. So I think the clinicians will make the call, and I'm certain that they've already made contact with some of the patients that they have in their clinics. If not, I think we'll encourage them to do that. Thank you.
Thank you so much for the question. I think we are moving from the premise that this virus will be defeated. And it must be defeated. Because failure to defeat it, the consequences are so severe that it will literally disrupt everything. So our planning is that we are guided from the national perspective by our president, from the province by our premier. But where we are, this thing must be defeated. And I can assure you, we will defeat it. South Africans have defeated many things. And you know all of them. There was one thing called pink eye in our lifetime. I hope those that were there that time will know something called pink eye. So I want to leave it there. I think we really feel that we'll defeat this, and we honestly want to defeat it. In terms of social grants, I think the first batch of social grants have been released, especially for those that are weak, the elderly and the children. And part of the sectors that have been given reprieve are those that are social grant recipients, which simply means that they'll continue to receive the social grants even during the lockdown period, because these are the part of the sectors that we really believe need to be protected. Thanks, Premier.
I just deal with the question about those who are trapped in South Africa. That question can best be answered by national government. We deal with the sub-national issues, and we have no illusion. There are national issues and there are global issues or country-to-country issues that will be dealt with by our national government. So what to do with those who have come into our country, that matter is being dealt with at a national level. So I would like to leave that question there.
All right. I think we are done. Oh, is there another question? Oh, quickly.
I'm sorry.
Yeah.
If I didn't hear or you skipped my question, Mr. Masuku, I asked clarity regarding the bed situation because your colleague mentioned 2,000 beds.
Yes.
And then I don't know if I missed that. I'm sorry.
Oh, okay.
Oh, okay. Okay, thank you.
No, he did. Okay, all right, fine. The MEC will. They just want to know the current number that we have.
No, we remember there are beds that I've spoken about, you know, which are for hospital, ICU, high care, and hospitalization. And then there are beds that are the ones that we're going to use for self-isolation and self-quarantining that we're building up. Currently, we do have facilities that we are using currently, where there are students, you know. So the more the people come in, the more we will be able to actually get them accommodated. Remember, we do have a figure, you know, of people already that are on quarantining. No, don't be
Okay,
confused. Yeah. Yeah.
It's fine. All right. Let's bring it to the end. You can still speak to MEC Masuku. And you can also reach us by phone for any further questions. We will assist you. All right. Thank you very much, Premier MECs and all the colleagues from the media.